Do you have shoulder problem, shoulder pain, and it's just when you lift your arm up or whatever it is that you do in through movement, you get pain here? If so, this video is just for you. Stay tuned. All right, let's talk about shoulder pain and what you can do to increase mobility within the shoulder joint. First of all, you need to make sure your workplace is ergonomic friendly. Otherwise, whatever exercise you're doing is not going to last long because you're adding to the problem as you're attempting for the problem to go away. So, talking about shoulder joint. Just like your hip joint, it's a ball and socket joint. So you've got the socket from the shoulder blade and then the ball from the arm bone going just like that. So every shoulder issue requires attention to the actual shoulder joint, your shoulder socket from your shoulder blade, and your neck. So let's just concentrate on the ball and socket and how to increase mobility there, kind of loosening up, so to speak, of the soft tissue within the joint. So a lot of times we're used to moving the bone, the ball inside the socket, going through that movement. This is actually the opposite. So you're gonna stabilize the arm and move the socket around it. So what you're gonna do is you're gonna sit just like this. So your hips are nice and open. If your hip starts hurting, you can move your leg back and forth. Try to figure out what you can do to avoid pain here so your brain can concentrate on what it is that we are doing. So what you want to do is you want to engage your barrel. We're going to put a video on what that even means. Nice and rectangular torso. You get your hand in your armpit. So here's the key. You don't want to roll the shoulder forward like so. It's nice and square right across. This other hand is parallel to your thigh. You put your hand right there. You're gonna rotate not the body, the top part, or the shoulder like so. You're gonna tilt the whole rectangle, pivot around the bottom hip. So it's over here, this other hand goes there, nice and square. Engage your pelvic diaphragm and you rotate in all the way. And you rotate out. Once again, this is stationary. You're rotating in without rolling your shoulder forward or collapsing. And you rotate out to that level. You can even rotate back without letting this go forward. So keep it there and go a little bit beyond there. Meanwhile, you want to make sure that you don't lift your legs up or anything like that. So that way you have the ball stationary and you move the socket around it. This is a great exercise for everyone who uses digital devices. Thanks for watching. Make sure you subscribe to the channel. And if you have any questions, contact the office. Take care.